It's called donanemab.
It's a new drug that patients with early stage Alzheimer's disease will have access to.
Dr. Michael
And it's
Rosenblum is an
designed as a
associate
monoclonal.
professor of neurology at UW Medicine and clinical trials director at UW's Memory and Brain Wellness Center. He calls the FDA-approved donanemab a milestone drug currently offered to patients with early-onset Alzheimer's disease.
It's not curative, but what it does is it allows patients who are in the early stages of the disease to stay in those stages longer.
And buy precious time with their loved ones.
That buys a patient roughly, 7 months over an 18-month period when they're on the drug compared to somebody who is not on the drug.
Donanemab is a monoclonal antibody given as an infusion. The medication binds to proteins that build up as amyloid plaques in the brain. By binding to the plaque proteins, the drug's antibodies trigger the patient's immune system to clear those plaques known to cause Alzheimer's.
They remove amyloid, but also we know that there's a clinically significant slowing of cognitive and functional decline.
Donanemab works similarly to lecanemab, another medication offered at Harborview, except the donanemab infusion is given every month while lecanemab is given every 2 weeks. HealthLink talked with UW Medicine about lecanemab 2 years ago, which showed promise to reduce Alzheimer's disease from progressing. And donanemab is revealing similar effectiveness. Trials have shown a reduction in cognitive decline by 30%. Dr. Rosenblum says it's important to note the medicine is not a cure, but a way to manage what he calls a chronic disease.
And there are other chronic diseases like heart failure and cancer and diabetes and hypertension. And we don't have cures for those diseases. We have drugs that make life with these diseases more manageable. And donanemab is essentially doing that.
Those interested in learning more about donanemab should speak with their doctor. For HealthLink, I'm Christine Pei reporting.